Okay, so welcome to the discussion over rectocele, which is when your rectum has fallen forward into the vaginal wall. So your rectum isn't leaving your vagina, it is not leaving your anus, it has fallen forward towards the vaginal wall, towards the vaginal opening. So it may even droop on the outside of your pelvic floor, on the outside of your vagina, and that's a grade 4. If it's just to it, then it's a grade 3. 1 means anything is moving, and 2 means anything in between that. So there are lots of causes of a rectocele. Number 1 is childbirth, but I want to skip down to the bottom that it may actually just be gravity. So if your breasts aren't where they once were, then your organs probably aren't either. So you may have tissue laxity, increased flexibility, but it's all about how long those ligaments are. Those ligaments are stretched out when you have a long labor or if you have a short and fast labor. So I had 2 very short and fast scary labors and also suffer from degrees of this as well. Perfectly managed and asymptomatic, which is my goal for you. So not everyone who has a baby suffers from a rectocele, which is just nice to know that. If you don't think you have one, then just be nice to your pelvic floor and do all the things so that way you prevent this from happening. So other issues that can cause this is chronic constipation, chronic coughing, so a history of smoking can lead to chronic bronchitis, and then just bearing down every time you cough is right there, bearing down with constipation. I've mentioned before that I have a surgeon who won't do bladder lifts or rectocele lifts if the person suffers from constipation. If you can't properly poop, then why would they lift everything up for you to push it all back down? So a lot of heavy lifting what can be a cause of any organ prolapse and obesity. So again, I like to mention that it stinks to be told by a health provider, you know, you need to lose weight, but if it helps keep your organs inside your body, I think that that is a huge motivator. Older women may also suffer from this because of their lack of hormones. I do refer them back to their primary care doctor, OB, or urologist to manage their hormones. And I find that just 3 weeks into whatever hormone situation that their physician has prescribed, that tissue already feels better. Tissue is supposed to feel like this thumb muscle. Like whenever I place my finger and just rest it on the inside of that muscle, it'll just feel like just some girth to it when there's less hormones or when someone's having chronic pain or those muscles just aren't firing the way they should. It'll feel more like this web space. So just a lot more lax versus that girthiness, and hormones are huge. So if you do suffer from symptoms, it may include heaviness at the rectal area, especially during or after pooping, or you may actually feel the protrusion of something at the vaginal opening. Constipation may actually it may be caused from trapping of this stool. So things are getting kinked up, they're falling forward, and then you're having to bear down. It's like a double-edged sword. And so I'll talk about splinting in the next video. So a lot of people that have this, they'll tell me that they poop and they feel like the first one's done. And then like 30 minutes later, they're having to go again. And 30 minutes later, they're having to go again. And it's because this poop is sitting not at the rectum, but has fallen forward. And then as they're up and moving around, that poop eventually gets over the rectum. Then they feel like they have to go again, and they do. And so I hope to make that pooping more efficient. So you'll be diagnosed by this by your OB or gastrologist. And so they may do a vaginal exam and see that it's fallen forward. They may actually do a rectal exam. My favorite thing to do for this is to get right to the heart of the matter. And I like to have standing exams. So it's nice and awkward and we get to laugh together. But I place my finger at the vaginal opening and I just rest it right at the edge of the pelvic floor muscles. And then I just see what is, or feel what is pressing down on me when I have you do everyday things. Like if you are a weightlifter, then I'll see what's happening whenever you lift weights. What happens whenever you bend over to pick up your baby? What happens whenever you lift your arms over your head? I want to see what or feel what is happening throughout the day. So that way we can make you more efficient and help you have those symptoms a lot less. So there's 3 different treatment options going over to the next page: pelvic floor exercises or just plain exercise. So I don't really give a lot of actual Kegling, but I get a lot of pressure management skills and strengthening up all around everything. So that way you're more efficient when you're sitting to standing, when you're bearing down, when you're all the things. I find out what the things are that are hard for you and then make them specific to you. So there's also pessaries. So I want to show you what a whole bunch of pessaries look like on the, I tried share. Here we go. So there's a whole bunch of different options for pessaries. You can get fitted from your OB, and if they don't, you could call and you could find out who does. But it is a type of support. I like to call it a sports bra that is helping support everything and holding everything up and in. They all look very different. You can be, there's just a ton of different kind of stuff out there. And all of them serve a different purpose. So holding up the uterus, holding up the bladder and the uterus. This one is holding up the bladder, uterus, and actually pressing down at the rectum, hopefully causing like a backstop to keep that from moving. And what's nice is that the healthcare provider will go through all of this information with you and see which one works best for you. So I'm going to go back to my handout. Okay, so those are pessaries, sports bras for your organs. I have several in my clinic. I let people just kind of feel like they're pretty hard. There's also temporary options on Amazon. Specifically, I guess I should show that too. A bladder support, but this is what it looks like on Amazon. And it's $30 and it's reusable. 34 inflation. But it looks like this. Oh my goodness. It looks like this. And so that space squishes and then it sets up inside you. And then this little part right here presses up on the bladder, or you can turn it whenever you put it in, you would turn it and you could face it out toward the rectum. I've used this in the past for a year after my 3rd baby, and I did not like the applicator because it was something else I had to clean, and I have enough to clean. I don't need, I have a whole house and a whole bunch of humans. I don't need something else to clean because this is reusable. It comes with 30 different strips, 30 different strings, so you can take this thing in and out of you like a tampon string. I eventually quit using the strings and just I'm used to using the NuvaRing for birth control, and this is very similar to that. I would only use it whenever I was exercising or had a long day, but it is I thought it was very, very helpful to help and support everything. So that way, as I was strengthening up my pelvic floor organs, that these were up and out of the way, or pelvic floor muscles, that the organs were up and out of the way, and kind of let my muscles go, which was really nice. So then there is, of course, surgery as an option as well. They have a lot of new techniques out there. There are some that are a lot less invasive as they used to be decades ago. There are some really great surgeons out there who won't do the surgery, though, until you manage your constipation or stop smoking or have your coughing under control. So meeting with a pulmonologist, respiratory therapist, and make sure that they don't want to stitch everything back up for you to ruin it all with your daily life habits, and I don't want you to either. So you can also take care of yourself and prevent all of this from happening by treating and avoiding constipation, avoid heavy lifting, or managing and being stronger and more efficient at heavy lifting or lifting correctly, by treating your cough or bronchitis, not smoking, avoiding too much weight gain. Remember, keeping your organs up inside you by decreasing the amount of weight that they are having to hold up, doing your pelvic floor exercises. But not only that, remember, I don't do very many Kegels. It is all about decreasing the demand of the pelvic floor by making you more efficient with the tasks that are specific to you. So I personally like to go for a short run. I come back and then I do anything in an inverted position. So push-ups with my booty up, bear crawls, shoulder taps, laying on my back with my legs on a ball or on the side of the couch and doing bridges or doing all my arm exercises, but I'm allowing my hiney to come up and letting gravity come back down. And then I go for a run, I come back and do it again. And I do that the length of a Paw Patrol or the length of a nap or whatever else I can cram into that. But I like running. It's efficient for my body. It is fun. I get the dogs out. I run on the property and then I come back. And after I just smushed all my organs down, I think about ways to lift them back up. So I love yoga and doing anything where you can just put a pillow under your bottom while you watch TV or whenever you read. We like upside down reading. We have a big pillow. My butt goes up on a pillow and then everyone reads and everyone's upside down and it's really nice. The book is up high and then we just really enjoy ourselves. So you can also think about intimacy, putting a pillow under your bottom while partner may be on top, or you could go from behind, doggy style, whatever you want to call it. I saw a comedian calls it princess style. Anyway, that's kind of funny. So remembering that there are ways to do everything, and that if you suffer from prolapse, it actually should not be uncomfortable whenever you're having intimacy. And if it is, then it may be something else that a healthcare provider needs to look at, because maybe those muscles are tired of holding up these organs, and so they're having increased pressure, and then whenever you're having intimacy, they are just not relaxing. So something to consider. So I hope that answers a lot of your questions about Rectocele specifically. And remember, you are fearfully and wonderfully made. Take care and God bless.